And welcome back to Paramedic Project. Thanks for joining us once again. Today we're expanding on themes on the choking patient and approaching these cases and some big tips on how to do these successfully. So last time we talked about the dynamic nature of the patient. We talked about assessing the patient and putting them on that continuum between a clear airway and a completely obstructed airway. And today I just want to expand on actual management of these patients on that continuum and share with you some of my big tips for the choking patient. First thing I think to acknowledge is that this is a big team approach. You know, we think about a normal size or a smaller patient, we can manhandle them around in the positions we need to clear their airway or to help them clear their own airway, just probably one of us. But if this is a big patient, it's going to really require two people. So that means that we're going to be working extremely hard. It's hard physical work, often especially if the patient is lying down. Often these big patients are really hard to roll onto their side to get them in an appropriate position to clear their airway. And so that will often take two people. That might be you and your partner, it might be you and a bystander or a family member, but often you've really got to work hard. So it's important to acknowledge that, you know, this might be a case where you need a bit of muscle. So that's a really good thing to keep in mind. The other thing to keep in mind is that yes, it's a team approach to often move the patient if they're big, and that team approach needs to take into account where the patient is going in their clinical trajectory. So if the patient's deteriorating, at some stage your equipment for airway clearance, and that's not just your laryngoscope, but it's also all the other tools in that sort of equipment, in that equipment checklist, that needs to be set up at some stage. So if you're the one who's manipulating the patient or helping them to get into the appropriate position or helping them clear their own airway, then your partner's going to have to set all that up for you, or vice versa. Now that might be unseen if you can't get the patient out of the house, or if you decide to stay there and help the patient clear their airway before going. But if it's in the back of the car and they've got a partial airway obstruction, often your partner's driving, you're in the back, you might need all of that equipment set up before you actually take off from scene towards the hospital. So that's an important thing to often direct your partner to do while you're caring for the patient, is to just get that equipment station set up. And with that in mind, it might also be an important case for you to call actually another set of hands to scene to help you. Now this doesn't need to be a high clinical level. Often it might need to be a high clinical level, but it might be great just to get an extra set of hands, either someone to drive the ambulance appropriately and have two paramedics in the back, just so that we can physically maneuver the patient, manipulate them into the right positions so they can clear their own airway. So that's a really important thing to keep in mind also. The final thing I want to talk about too on approach to these patients is setting up your scene really, really well. And obviously this patient here has got a lot of room around their head, which really gives us great access to the patient's head, a lot of space to perform our laryngoscopy if needs be, a lot of space to position the patient. But not all patients are like this. You know, some patients might be wedged between a bed and a wall. Some patients might have their head up against the wall here, which means that we don't have access to that airway of the patient. So if the patient is critically ill and they're unconscious, early on in your play, you're going to have to go to that patient, move them appropriately, and get them into a space where we've actually got great access around the patient's head, so that we can actually perform the skill really, really well. So they're my three big tips. It's a team approach, and that's going to mean often moving the patient and gear setup. It's not just a one-person job. So keep that in mind on the way to these patients and on approach to these patients, and everything will go well. So thanks for joining us once again. It's been Paramedic Project. Next episode.